All right, everybody, welcome back to Beyond Limbs, Amputee Answers and Options. This is Bart and Scott, and we are going to talk about what to expect when it comes to the process, the actual amputation and the recovery and just how that looks. And so I'm going to start off by just talking about what went on with me, and then you can add some other
hmm
things that may or may not happen.
Okay.
I went into the hospital. I was amputated probably somewhere around, I was back up to my room by 4 o'clock, probably, or I was up in my room by 4 o'clock. And they actually did what is it called? I forget what it's called, where they reconnected some nerves,
Nerve intervention.
nerve intervention surgery. And so that took my surgery to a little bit longer. But anyways, back up to the room and awake and feeling okay. By 4 o'clock, like I said, my nephew came in with his pirate sword, said, "Too soon." And it wasn't too soon. I was doing good. I was in the hospital so this was Monday. Friday, I could have gone home, but they put me to the acute rehab center that was on the 11th floor of the place that I was at, the hospital I was at, on Saturday. And then I was there for 3 days. Normally, that was a 10-day to 2-week program, and they said, "You're good. Do you want to go home?" And I said, "Yes, I do." I
Mm.
was tired of being woke up in the middle of the night to check vitals or to take blood or pee or whatever. And so I was glad to get home. During that process, it was probably, how long before you came? Was it 2 or 3 days out?
It was
Once
just
they took the drain tube out
it was a couple days out. Yeah.
and you came and you brought a protector slash compressor slash, I don't know what it was.
It's called a immediate post-op dressing, which is designed to protect the residual limb, and it's also designed to start compressing the tissue down to help speed up shrinking, to help get it ready for the prosthesis.
And so you left me with a bunch of socks to put on every day and to continue that shrinking and had a Velcro thing. It looked like a knee brace. That's
Mm.
what I thought it looked like. I mean, you could have different doctors, different prosthetists, use different things. Some people use a hard cast. I should say some doctors use a hard compression cast. Some people just use a ace bandage type of thing. And I was in an ace bandage with a thing to keep my leg straight so that I didn't bend it and have it freeze in the wrong position. Then after that, like I said, I went home. So that was probably 8 days, 9 days. I remember I didn't do much for the first 2 or 3 days. And then I decided on Sunday it was time to go for a drive. We went for a drive, and that's when I had the confidence. That was probably 10 or 11 days out post op. And then by day 13, I was driving by myself and going shopping, doing stuff. I was off pain meds. My pain meds were minimal at best. I didn't have any real pain, it didn't seem like.
Some of the things that vary depending on patients, of course, pain tolerance. Pain meds may need to be on there longer. Infections, if the amputation was from an infection, you might be on IV antibiotics or oral antibiotics. And they're concerned about the tissue, the wound closing, amputations that were for traumatic. There's different things with healing, with bones, skin grafts, all those kind of things. So the basic concept of all of them, though, are once you're amputated, then the tissue is going to swell. The faster that we can get the tissue to reduce in size, whether it's using a shrinker sock, compression sock, a rigid removable dressing, an IPOP, which is immediate post-operative dressing, or a combination thereof, to get the tissue to be compressed so that when you do get ready, when the doctor takes the stitches or staples out and gives the go-ahead that the tissue's good and it's strong enough to bear weight on, then the prosthetist is ready to go with that.
And so it took me 2 weeks, maybe 3 weeks to get the stitches out. Then you put me in a shrinker or not a shrinker, a liner. So this is the liner here. And I wore that liner without a prosthetic during the day. At night, I had a shrinker sock on basically while I was sleeping. Phantom pain is something that I haven't really experienced except when they pulled out the drain tube. Then it shot down to my toes that weren't there. So one thing I want people to understand, they need to be an advocate for themselves when they're in the hospital. When they pulled out the drain tube and that pain shot down to my toes, my stump just clenched up and all those muscles tightened, and it was quite painful. And the nurse that was there at the time had been called in from their day off. So they were on call. They got called in, weren't happy to be there. I pushed the call button. She came in, and the PA who left, who pulled the drain tube out, she said, if you need more medication, you're going to have to just call me and we'll make some changes because we need to keep this pain under control. The nurse, when she came in, I said, I need more pain. She said, I can't give you any more left. I pushed the button. 45 minutes later, I need more meds. She sent in the tech, and the tech says she's not coming in until she can give you more meds. I told the tech, you tell her that either I'm calling my doctor or you're calling my doctor because we need to rethink this. She immediately called the doctor and they redid my meds and they got me back to get the pain under control. It was 4 hours of getting that pain under control. If I would have let that continue, I don't know how long it would have been to get it under control. So you need to be an advocate for yourself whenever things are going wrong. Don't just accept the nurse's word, the doctor's word. Make them do what needs to be done within reason.
Yes.
Other things to talk about is, okay, when you put me in my first now I didn't go to physical therapy after the hospital's physical therapy. Once I got my prosthetist or my prosthetic, I didn't go to physical therapy. I just did what you said to do. So the wound was closed on the outside, but on the inside, there was still some healing happening. And when I put my leg pressure on my prosthetic, it hurt. It was a burning sensation. It was basically the wound being pulled, and it just was hurt and it hurting. But you have to go through that process and still do the 5 minutes 3 or 4 times a day of walking to help that healing process happen. What do you tell your patients how to decipher what is pain they should be worried about and pain that is normal? Because that was hard for me.
Yeah. What I tell my patients is that if it's like a tight shoe, a tight squeeze, that's somewhat normal. If it's a sharp pain or a extremely painful squeeze, then we need to look at it. And so there's different ways to look at the tissue once you step into the prosthesis, and the prosthetist takes it off and looks at your skin to see if the blanching or kind of the pink reddish color of the tissue or a deepening, darkening of the tissue, whether that goes away in a few minutes. And it's something that you'll get a feel for like you did.
I say it's a burning because it's the incision is pulling apart or is being pulled, not pulling apart, but it's being pulled. And that pressure causes an uncomfortable burning versus a sharp pain so when you get a blister, it's a nagging pain that you can feel. Once again, it's hard to explain. It's like saying, what is love? Or what does salt taste like? It's hard to explain, but you'll get a feel for it. And you do that by looking at your limb several times a day. So in that first month, probably, I was looking probably at my limb 3 times a day just to make sure there weren't blisters, to make sure there weren't sores or if there were, I need to stay off it. I did get a blister that was from, you said it was from the sweat heating up. And so you told me to go get nursing pads and put a nursing pad at the bottom of my liner so that it sucks up the sweat so that it keeps it away from my skin. I think I probably had 2 or 3 small blisters, and you don't want to pop those, right?
No, you don't want to pop those. You're sweating and you've got perspiration going on inside the liner. So they probably may pop, but don't pop them on purpose. And if there's a concern, then don't wear the prosthesis until you see your prosthetist again and let them help you decide whether it's normal or whether it's not normal. Because there's a lot of variance on pain tolerance, a lot of variance on pressures in the socket where people's nerves are amputated, if they had the nerve reinnervation surgery to connect the nerves together, if they didn't. So there's a lot of different things. And so the main thing is be an advocate and just let people know and don't try to force it if it's too painful.
And this is something I don't know if you get with a bigger company or every prosthetist or not, but I would shoot a picture of my blister or whatever, or my incision. We had a time where there was a little hole starting, and I took a picture of that, sent it to you, and you told me, you texted me back saying, stay off it for a day, or like you said, like I said, to get the nursing pad. You told me not to pop it. Someone else said put alcohol on the blister. It will help shrink the skin and help dissipate the blister. But I have messaged you several times with a picture of my stuff asking, is this normal? Is this okay? What should I do? And you have responded. So I don't know if you get that with every prosthetist. If you don't, maybe you should change your prosthetist. Then once you get your prosthetic, it probably took me a month before it was comfortable. Meaning I would start out in the morning. So first of all, it was only doing walking on it 5 minutes constantly 3 or 4 times a day, and then keep the prosthetic on most of the day. Then whenever I got to where I could walk on it more and more and more, in the mornings it would hurt because it was swollen. And then I'd put my prosthetic on and I would start to walk and get going. And the rest of the day, it was probably okay. But it was just that start in the morning, it hurt more than throughout the day. And then after about the first month, maybe month and a half, that all went away and I can put it on and it didn't really hurt. It was just normal. For me, that's what happened.
And there's different aspects of healing that is going on. Your skin will heal first, then you've got your bones. If anybody's had a broken bone, sometimes those take 6 to 8 months to heal up. And so the amputation cuts through the bone. So you're going to get pain from the skin, pain from the nerves, pain from the bone. That just all depends on how everybody's system handles it. So if you're still getting pain from the bone, that's a legitimate pain, and that can last for a long time. Just again, be vocal, ask questions, and hopefully feel comfortable with the answers that you're getting.
And each of those pains is different.
Mm-hmm.
You can feel the difference between skin, a bone pain, and nerve pain. Nerve pain being the worst, but in my opinion. So just like you said, be an advocate for yourself. Ask questions. If you don't understand it, make them answer you until you understand it. That is how the process was for me. And then here we are. What are we, 9 months out now? And we have some things that have come up that we're having to deal with. Some nerve pain that has happened. Just because it's going well doesn't mean it's going to go well for the rest of your life. You're going to have these different issues come up, and you just need to, once again, ask questions, deal with them, and get to the right person to help you.
Yes.
All right. That does it for the process with the amputation and the healing process. We'll be back with different types of feet and different types of sockets.